Hi, and welcome to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back.
We are going to tackle a hot new trend with feeding children called baby-led weaning. And I'm excited to discuss that with you today.
Yes, I think this will be really fun. We have some very broad guidance from the American Academy of Pediatrics, but not specifics. There's a lot of nuance to this to discuss. So I'm really excited to see what we come up with today. So let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
Okay, so right off the bat, I just want to say a couple of sentences about what baby-led weaning is so that we're all on the same page. And in very broad terms, baby-led weaning is the idea that when the infant is old enough to start solids, you are not doing a puree phase or a spoon-fed phase. You're going straight to putting foods on the baby's plate that they can pick up and feed themselves. There's a lot of nuance to that. We will get to that later, but just to lay a foundation. And the other thing I want to say at the outright is that the term baby-led weaning still comes with a fair amount of confusion. And I realized why that is as I researched this more for this podcast. That's because the person who really coined the term and started this movement of baby-led weaning, her name is Gill Rapley, and she is from Britain. And she even talks about how in Britain, the idea of weaning is at the initiation of solids, that as soon as you're putting anything besides breast milk or formula into the infant's mouth, you are starting the transition to weaning from breast milk and formula. Whereas I think in America, we associate weaning more with the end. That last time that they breastfeed, they are fully weaned from breast milk, or the last time that they take formula, they are weaned. So there's some confusion just in the terminology, but so that everyone's on the same page, baby-led weaning is referring to the initiation of solids.
Right.
And actually, just out of curiosity, I wanted to verify, is there still confusion about this? Because I remember being confused when I first started hearing the term baby-led weaning years ago. And so I just generally started polling people in my circles, knowing that we were going to do this, of different age ranges and stations in life. And sure enough, there were some people that immediately were like, oh yeah, that's when you can just give your infant a chicken bone with meat on it. And others who were like, wait, are you talking about at what age you stop breastfeeding your infant? So even still, we have to define it. There is a little bit of confusion still about the name.
Right.
Yeah. So Sylvia, go ahead and give me your thoughts on initiating solids.
Sure. So when I recommend introduction of solids, I usually talk about baby readiness.
Yeah.
Is your baby ready to eat solids? And I usually have 3 criteria that I recommend. The first one is that they're interested. Sometimes the baby is sitting at the table while the family is eating or the parents are eating, and the baby starts watching the parents eat. So interested, watching the food go from their plate to their mouth and back. They're tracking the food. Like, what is that? And I am so interested. Sometimes babies will even reach for their spoon en route to their mouths and guide it to their own mouths. Like interest. The second thing babies need to have is the ability to sit up. Be able to have enough, back axial control to sit up and be able to sit for solids without getting fatigued too early, right? So the gross motor needs to be there. And finally, the last thing that I tell parents is that there's a tongue thrust reflex that exists for infants. And if you imagine when they're nursing or they're on the bottle, the tongue is what kind of milks the fluid into their mouths. The tongue thrust is how they eat. And sometimes they show all other signs and the parent introduces the food. They're so excited. The mouth opens, the bolus goes in, and then the tongue thrust happens, and then they spit it right back out. So that reflex of the tongue thrust needs to have gone away. So when I talk about first foods, solid foods, those are the 3 preview things I recommend that parents kind of check boxes to make sure, yes, we're ready to introduce solids. And that can sometimes be parents, they're early and they want to do it a little bit before the 6-month visit, like at the 5-month mark. And sometimes even by the 7-month, they're not showing those signs yet. So parents hold off.
Yeah, I fully agree. Just to give you a little history on that, the World Health Organization recommended that babies be exclusively bottle or breastfed until 6 months of age in the early 2000s. And then the AAP fell in line with that. So I feel like what you just said is very, very much in line, whether you're puree feeding or baby led weaning.
Right.
We all agree on these same tenets of when it's time to start talking about solids. I think we also are going to all agree that breastfeeding, formula feeding, that is all going to continue. It's going to be months until you start to see a significant reduction in the volume of milk that's being taken in, because it takes that amount of time for the baby to learn to take in the calories from solids.
Right. I definitely say that when we talk about solids, is that the nursing or the bottle feeding schedule does not change. The
Yes.
amount should not be different. There are not significant calories that are introduced with first foods or first meals that it takes the place of any calories taken in by milk.
Right. Yes.
Right.
Totally agree. Okay. So then tell me how the options that you give parents.
Sure. So, this is an enjoyable time for
Oh,
parents.
yes.
And
Yeah.
also an enjoyable time if there's an exclusively nursing baby for other caregivers to enjoy feeding babies too.
Yes.
Be it fathers or grandparents, they love feeding. So I don't like to put too much restriction in that joyful process because, culturally people may have different cultural first foods and, I give them freedom to explore first foods the way that they want to, right?
Yes, I love that. I love that. I loved it when we would get to that phase where they were big enough and old enough to be sitting in a high chair at the table. And
Yeah.
that's young, 6
Yeah.
months, but now they're actually at the table with everybody, fully in their own chair, sitting there watching you. I love that. You're right. That's a very joyful time.
If parents ask, and sometimes I don't offer advice at every 4 to 6 month visit unless there's very specific questions, because I do want there to be more freedom in
Yeah.
introducing foods. What I do recommend is kind of food groups initially. Like the first food is not a piece of steak. I recommend either fruit, vegetable, or some sort of grain. And then as the repertoire increases, I do recommend that they introduce one new food every 3 to 5 days, just in case there's a reaction to something. Really to kind of be on alert for sensitivities or allergies. I was particularly sensitive with this because I had children that had food allergy in their introduction to solid phase. So it's something that I was on high alert for.
Yeah. I think as I talked with families, it doesn't have to be so hard and fast. If they're giving the infant things off of their plate, often there's things that are mixed together. That is okay, but particularly with infants that are struggling with signs of allergy, like eczema, for example, it becomes even more important to just reassure yourself that you can start introducing foods that are not aggravating any allergy symptoms.
Right, of course. So, those are kind of the general recommendations that I give. But, how you introduce that, I don't specifically go into it unless there are questions. So, if they ask my initial recommendation, I still recommend mixing milk with rice cereal or oat cereal into a very thin slurry and introducing that with a spoon as the first food. If parents ask if they can jump right into baby-led weaning, which is what we're talking about today, I say absolutely yes. Give it a
Yes.
try. Yes.
Yeah. So when I talk to parents, I usually say the goal is that at 12 months, this baby is going to be mostly on table food, mostly what you eat, feeding themselves, and taking the majority of their calories from solids. So we are talking about a 6-month period of time, right? How we get there can look very different. There's not an exact formula or right way to get there.
Yeah. My interpretation of baby-led weaning is to forgo the puree portion. Baby-led weaning skips this stage where they recommend, instead of a spoon or a utensil involved to feed the baby, that the baby feeds themselves. And the food is prepared or taken from a portion of the adult food that's already prepared into soft pieces that can be manipulated and picked up by infant hands and introduced to their own mouths. So that is the difference between the puree recommendation that I still give in the office and the baby-led weaning technique that is outlined in this new trend, right?
Right. Absolutely. If you want to
Yeah.
use baby-led weaning, use it. From what I understand, the woman who coined the term and founded it gained popularity in the UK around 2015.
Right. There's actually a book entitled Baby Led Weaning, The Essential Guide to Introducing Solid Foods and Helping Your Baby to Grow Up a Happy and Confident Eater. And it's written by Gill, Rapley, and Tracy Merkett. And on the cover, it actually says, no purees, no stress, no fuss.
And the AAP does have literature we can put a link to, just talking about baby-led weaning, the basics of it, the benefits of it. Is it safe to do? Some common things to discuss, etc.
Now that we've kind of defined the introduction of solids and what baby-led weaning is, we'd like to spend some time in the second half talking about our own personal experiences of feeding our babies and introducing solids to our own children. So Vivian, why don't we start off by having you talk about some of your memories of feeding your children when they were young?
Yeah, actually, I think this will be a good way to set us up for a next episode where we compare and contrast baby-led weaning and traditional solid feeding in more detail, because I do know in baby-led weaning literature, there's sort of this idea that when you're spoon feeding a baby, you are kind of force feeding them. It's not perceived as baby-led anymore, hence the name and the distinction, and that there is a not listening to the cues of the infant as to whether or not they're hungry or not. And I feel like in my own experience, obviously I did have children that I started off on purees. That was really not what I remember. I have one child in particular. I have a video, I could pull it up right now, of a child that I remember when he started solids at 6 months and it was purees. I would put the spoon to his mouth, he would open it, he would take the food, and he would make this cliche vocalization where he would have that food in his mouth and he would be going, like he couldn't even talk yet, but he could make these vocalizations to indicate how much he was enjoying the food. And it was just a really fun, when you talk about that joy of feeding solids, he was really fun to feed solids to and really fun to feed purees to. So I never, particularly as I think about him, there wasn't this sense of really forcing it. And it did still feel baby-led because he was enjoying it. I also have this memory with my kids where it was so much like Baby Bird, like they would finish that spoonful of food and they would open their mouth so wide as if their jaw came unhinged and they are just staring at me. Like I don't even have a spoon ready. They just have their mouth wide open and are staring at me like they are indicating to me on so many levels, I am ready for that next bite. Where is it? So I think that it's a misnomer that feeding purees can't also be baby-led in a lot of ways. Mm-hmm. It's certainly a misnomer to indicate that feeding purees with a spoon is always force-feeding the child, because that was definitely not my experience and not an experience that I hear from patients.
Yeah, I feel like your story is something that I hear often in the office when people are describing feeding their baby for solids. And to allude to that enjoyment phase, like often grandparents or fathers or babysitters or older siblings, even if they're old and competent enough, enjoy feeding solids to babies that are eager to eat and try and enjoy food that way in a puree form. Right?
Oh, yes, absolutely. As I think I've said this before, my 6 children are 9.5 years apart in age range. So when my youngest was starting to eat purees, I absolutely had my 9-year-old and 8-year-old as part of the rotation of feeding him purees. And I don't know that I would have included them as much if I was really being mindful of introducing solids first, because I trusted them with purees that nothing was going to go wrong.
And I feel like those of you who have read the Baby-Led Weaning book, the narrative and the storytelling in the book is often very different than the experience that you're describing, Vivian.
Yeah. There's also so much information out there on baby-led weaning. And sometimes I hear these interviews where I think, Yeah, that just really isn't characterizing my experience with puree feeding my infant. Yeah.
On the contrary, I actually had some similar experiences to feeding introduction of solids as the book describes.
Oh, yeah, tell me.
Yeah, so one of my children was not a very good eater, very similar to some of the narrative in the stories that the book recounts, where it was a little bit of a struggle to feed solids. The mouth wasn't wide open to eat. There were times where, I felt the pressure to feed him for the calories, and this is a little bit further on when he's a little bit older, hitting that 12-month mark. And, he should more be on solid foods for calories at this point, and he just wasn't. And there was that kind of apprehension that a lot of the parent stories in Baby-Led Weaning book describe, where I really kind of sometimes felt like I had to force him to eat because he was not opening and eating purees for the calories that he needed, right? So I can definitely sympathize with the need for other feeding techniques. And at that time that I was introducing solids to him, the baby-led weaning technique was not a thing at that time. I do wonder whether or not baby-led weaning would have been a technique that we would have tried with him. Although one reason why I think it might not have been is that this difficult feeder was also a really bad gagger. So, the gagging would also lead to vomiting.
Yes. That
So,
makes it so difficult.
even if he, had it, opened his mouth and wanted to eat it, if it wasn't swallowed smoothly the first time, there would be gagging and then often vomiting of all, which we just worked on feeding him. So, I'm kind of thinking, even though we didn't do the baby-led weaning technique for him, I'm suspicious that maybe it wouldn't have been effective because he had such a gag vomit reflex.
Yeah, that's interesting. It's almost like, like we've talked about this in other aspects of parenting, this should be a tool that you have in your toolbox to try, but knowing that there's not a hard and fast way that's perfect for every baby. And I will say, I have heard particularly occupational and speech therapists who work with infants who have feeding difficulty, and this is obviously a more extreme examples, talk about this idea that baby-led weaning very early on gets all like motor sensory input involved, which is good for the baby's development as far as they're touching the food, they're picking it up, they're grasping the food. And then also just even that like sensation on the lips and gums is different as they're manipulating these bigger pieces of food that they're sucking on into their mouth. And I do think there's a subset of kids where that technique may help them quite a bit, particularly in maybe preventing an aversion to different textures later on, or helping them not get stuck on a puree stage. It's very hard to say. So, like you said with your son, maybe the independence of it, of him experiencing food with all of these different sensory modalities would have been helpful. Would he have gagged more, leading to vomiting? So then would it not have worked? In which case, it's nice to have purees in your toolbox as well, right? You need it all.
Right. Do you have any experiences about difficulty feeding any of your children, Vivian?
Yeah, so my most difficult feeder, it's a different scenario than yours, but my youngest son was born prematurely. And when we got him at 6 months, he's one of mine adopted from foster. I remember I took him to that first pediatrician visit that you have within a week of getting a foster placement. And the pediatrician looked at me and she said, "Your number one job now is to get him to gain weight." And I was like, oh, like you are talking to a person who knows how to do that. I can make this kid gain weight. And I had him on a very strict feeding schedule, which I alluded to in my infants and sleeping through the night. I fell back on that. We forced him to finish those bottles. I mean, this was not baby-led in any way, right? We were force feeding this kid.
Right.
And as soon as we could start him on purees, because as time wore on, we wanted him to start developing all of those mechanisms as well, right? All the mechanisms in place to be able to eat solids. So as soon as he was ready to start solids, we did, and it had to be purees because he was not going to show interest in anything else. And yes, we were basically force feeding him purees, but he was very compliant, right? I don't remember him fighting. It was more that had we not been putting the spoon to his mouth, he was not going to be interested in doing it. And for this kid where we were so trying to compensate with more and more calories and really stimulating more and more developmental gains, being able to initiate purees with him and then us really controlling, pushing him to eat more purees worked. And he gained weight beautifully. Right. But it was, it took a little bit of a different mindset. If it had been fully baby led, how much he was going to eat or drink, he would have lingered at a lower weight.
Yeah. I mean, this is a very good example of a medical condition that really kind of changes the way that we think about feeding the baby and the baby gaining weight and the necessity of that happening in a specific time frame. And maybe for those types of scenarios, the baby-led weaning might not be the best choice either.
Yeah, I agree.
I think this episode has been what the introduction of solids is like, rules that one could start abiding by, and some storytelling about what the introduction of solids was like for you and me.
I think we now have laid the foundation that we can really have a really thought-provoking discussion about baby-led weaning, because I do think the medical community does tend to get a bad rap for not liking baby-led weaning. And I don't think that that's necessarily true, but I do think there are things I would caution about with baby-led weaning that are important, but that doesn't mean I'm not a supporter. So I'm really excited to have a very frank discussion about our thoughts on baby-led weaning.
Great. Looking forward to it. This is 10 Kids, 2 Docs. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.